Thanks for being with us. How about this stat? Up to 14.4 million people could lose Medicaid coverage if the public health emergency from the pandemic expires after the second quarter of this year. That's according to the Urban Institute. That's because if the emergency expires, states will be allowed to resume disenrolling Medicaid beneficiaries who no longer qualify for coverage, a practice that was halted during the pandemic. Analysis from Paul Seegert, managing partner with PCS Advisors. Paul, what did the government do?
Well, what we did is, as a part of declaring a public health emergency, we extended extra funding that was part of the rescue plan so that states could afford to not verify if people remain qualified for Medicaid. So normally they would, at regular intervals, confirm that you're still eligible for Medicaid, and then you would be off the program if your income went up or you gained access to coverage, say it's your employer, that kind of thing. They have not done that. So more and more people are sitting on the Medicaid program that likely would not qualify if they were to be checked. And as soon as they sunset the public health emergency, states will likely virtually immediately start to check verify people's qualification for the program, because then they'll be on the hook for more dollars there.
And that's what, north of like 14 million people this could impact?
Yeah, it's quite a few people. The interesting part about this, or to me, an interesting part of the story, is that if you look at the percentage of uninsured Americans in the way that it changed, we moved the needle about 4.9 million people, and it went from 10.3% fourth quarter 2020 to 8.8% fourth quarter last year. So we moved the needle, certainly, with all of this extra investment, but we also moved quite a few people off of other coverage to government coverage, because we created what I would call some moral hazard there. It became very attractive for people. They could get subsidy, and maybe it worked out better for them personally to leave employer coverage, leave their individual plan, to go to the government program.
How do states verify? Do you know what that process actually involves?
Well, it shows some proof of income, and then if your proof of employment, proof of income, and if you exceed a certain level, then you no longer qualify for Medicaid. Now, you still could qualify for a plan that's received some subsidy in the Affordable Care Act exchanges, and those also were changed, the rules there. The 400% of federal poverty line rule, where subsidies used to stop, went away. That'll go through the end of this year, where no one that went to the exchange was going to end up paying more than 8.5% of their income. So we've also brought quite a few people there. You could have a 60-year-old couple making north of $200,000 a year that could get a subsidy today. And that's certainly worthy of a discussion as to whether or not that's reasonable.
Right. We're speaking with Paul Seegert, managing partner with PCS Advisors. We're talking about how millions of Americans may lose their health insurance. So, I don't know if this brings politics into it, obviously, but could it be possible that the Biden administration leaves the public health emergency in place through the end of the year so there's no political blowback of, hey, millions of Americans could soon be losing their insurance?
Well, some folks believe that it's been kept in place this long for that very reason, or certainly because they didn't want to have a bunch of folks lose their coverage at a really inopportune time. And then there's the other fact that we tend to add to programs. We don't tend to take away often. So even when they add things temporarily, usually there is the intent to later more permanently fund those things. So I think lots of us have expected that there would be some effort to make these additional subsidies permanent, and the Build Back Better legislation, if that does get through, that is part of it.
Okay. And then at this point, if, say, the public health emergency were lifted and states begin to verify and people start losing income, that could be partly because maybe states won't be able to afford it, since it is a federal-state partnership, right?
That's right. It's interesting when you look at it in terms of percentages, the matching and so on. Some folks get this misimpression that it's not a big item, budgetary item for states, but there are many states for whom this is one of their largest items on their cost, on their stack of costs that they have to fund. And if they lose the matching or the subsidies that are extended for this period of time, then they have to make some really tough decisions. Do we, and it could be literally, do we take money from other very needed things like education to continue this or not?
Thanks, Paul. Paul Seegert, managing partner with PCS Advisors.